Okay, so just a brief video from the production line you can see on the screen. So Dermaqual established in 2003 in Europe and becoming one of the leading companies in the Europe in production of the mesotherapies. Also now medical devices and also fillers like body fillers.
मैडम जी अगर आप बंद कर रहे हो मैं एक ना इंटरनेशनल साड़ी मीटिंग जूम मीटिंग है मैं उधर अटेंड की हुई
Okay. Okay. Mesotherapy is a minimal invasive technique involving local intradermal therapy, which means that we can inject the pharmaceutical products in small quantities in multiple dermal punctures to treating the skin. And why we should treat the skin axis? Because the skin is the first barrier and protection against external irritations such as UV radiation and chemicals. And also it has limited body supply to maintain the compensation. So we can do some treatments like mesotherapy to make the skin keep up with the external irritations. So Dermaqual has a wide range of mesotherapy containing rejuvenation, pigmentation, body sculpting, and hair growth stimulation. Today, we're going to talk about the pigmentation and one new product in rejuvenation. So just briefly, the anti-aging consists of Exocell, EGF, DQHA35, Mesoglow, Rejuve Eyes, and Nefertiti Lift. And the brightening and anti-pigmentation category includes Tranex Plus, which is the new product, GSH, Dermaqual, and Ascorbyx. Also for the body sculpting, we have L-carnitine and Supriol. And filler correction is Dissolvidase, is Hyaluronidase, and for hair growth is DQ Hair Plus. So the line of pigmentation consists of Tranex Plus, GSH, Dermaqual, and Ascorbyx 20. So first, how melanin forms. Melanin actually is producing in the epidermis layer, and it's producing continuously. So as all of us know, it needs multiple sessions of treatments, also home care and aftercare to have a good result with mesotherapy for pigmentation. Also, if you do peeling, you know, all of you may know, if you do even peeling, you need repeated sessions to maintain the results. Also, this is true about the mesotherapy. So, pigmentation is because of the melanin, and the melanin, we have two types of melanin in our epidermis, which is eumelanin and pheomelanin, and both are created from the tyrosine. Make this is smaller and see the chat also. Okay. Amazing. So this also amazing. The melanogenesis, which is the process of production of melanin, it started with tyrosinase activation in the melanocytes in the basal layer of the epidermis. So first, tyrosinase converts the tyrosine into dehydroxyphenylalanine and then to dopaquinone. The second step is the production of the eumelanin or pheomelanin. If dopaquinone interacts with cysteine and glutathione, it produces pheomelanin. If dopaquinone goes through a series of oxidations and reductions without cysteine, it produces the eumelanin. And we will see the difference between the eumelanin and pheomelanin in the diagnosed part. And after production of the eumelanin and pheomelanin, it will be transferred to the keratinocytes in the superficial layer of the epidermis, and then it turns visible for us. So we can see the pigmentation for darker or lighter skin, depends on the amount of stored melanin chromosomes in the keratinocytes. We can see the different colors. Also, we can see the pigmentation, which is the pathology that we're gonna treat. So this is a brief picture of the how the melanin can be produced in the melanocytes, and then it will go to melanosomes, and the melanosomes will be distributed into keratinocytes. So it depends how many melanosomes we have in the epidermis layer or how they are distributed in the keratinocytes. We will see different problems with pigmentation. So the hyperpigmentation refers to the darkening of the skin due to overproduction or uneven distribution of the melanin. For example, melasma, we have melasma, which is a brown or grayish patches in sun-exposed areas of the face, which is distributed. It's overproduction and even distributed in a deeper layer of the epidermis. So we have the genetic first, depends on the genetic and the skin color. We have more pigmentation in darker skin types like Fitzpatrick 3 to 6. And these kinds of skin are more prone to have melanin problems or melanin overproduction. Also, we have the hormone effects in pregnancy. We can have the melasma. If we have the HRT in postmenopausal people, or thyroid dysfunction can cause the pigmentation. And one of the most important thing is the UV radiation that everybody knows that it's the main factor and the primary environmental factor of having hyperpigmentation and melasma. Because it stimulates the melanocytes to produce more to defend the skin, so as a defensive mechanism, and also it increases the oxidative stress, which causes and induces inflammation in the skin. So we will see that the inflammation also causes the melanocytes to produce more melanin. We have skin inflammation, and we have post-inflammatory hyperpigmentation, PIH. And as you can see, after acne, eczema, or injuries, or even incisions, also CO2 laser, for example, fractional laser, we can see the hyperpigmentation after the treatment or after the injuries. So inflammation also can cause the pigmentation. Also, we have radical damage and oxidative stress. We have some medications, such as some antibiotics like tetracyclines and anti-malarias, and also chemotherapy agents. They can cause hyperpigmentation. And additionally, as I told you before, melasma can extend to the dermal epidermal junction, sorry, and it can go a little bit deeper. That is why treating the melasma is a little bit harder than other pigmentations. So we cannot like easy remove it with only peels or even lasers. So common types of hyperpigmentation, as we can see in the picture, can be melasma, which mainly is symmetrical and dark patches on the face, mainly. We have PIH after acne, after doing like aesthetic treatments like, such as um, fractional lasers. We have senile spots that it's very common. We can see on the exposed area of the face to the sun, and we have freckles. One additional thing about the freckles is not only the overproduction, it's mainly because of the uneven distribution of the melanin into the skin, and we can see it in lighter skin types. So how we can treat the pigmentation? This is the important factor. As we could see in the pathology, we can suppress the tyrosinase activity to reduce the melanin production. Also, we can inhibit the transfer. Means that the melanin is produced in the melanocytes, then it should go to the melanosome and then go to the keratinocyte. We can inhibit the transfer. Also, we can inhibit the oxidation and inflammation, which can reduce the production of the melanin into the melanocytes. And we can strengthen the skin barrier, so less UV radiation, less oxidative stress, and also we can evening the melanin distribution. So these are the strategies that we can inhibit the melanin production and distribution. So now we're going to introduce the Tranex Plus, which is a revolutionary product in Dermaqual, which has a sustained release technology of the tranexamic acid plus non-cross-linked hyaluronic acid, which includes high molecular weight and low molecular weight, also niacinamide, vitamin C, and glutathione. So we will discuss further, but all the ingredients in Tranex Plus kind of addressing one of the pathway of the production of melanin. So yeah, Tranex Plus targets and blocks the pigmentation at all levels and pathways. So we can be sure that we have a comprehensive approach to the anti-pigmentation treatment. So first of all, we have tranexamic acid, which works preliminary by activation of the inhibition of activation of plasminogen to plasmin. Here we can see and reduce the inflammation. Also, in the diagram, if you check, we have inhibition of the melanin transfer to melanosomes by the tranexamic acid. So it's really effective tranexamic acid in the pigmentation, but the problem that before they used to have it was that injection of the tranexamic acid is very painful. And also longevity of tranexamic acid in the tissue is very low. So by the sustained release technology and mixing it with two different types of hyaluronic acid, two different molecular weight of hyaluronic acid, we will make it more sustainable. Plus, it will reduce the pain. Second, we have niacinamide acid, niacinamide, vitamin B3, that helps strengthen the skin barrier and also has anti-inflammatory properties. We have vitamin C as ascorbyl glycoside is an activated form of vitamin C, with a suitable pH. This is an important point because with the suitable pH, it's very tolerable to be injected. Because as you might know, vitamin C injection in mesotherapy is very painful, and like rarely people can tolerate the pain. So vitamin C is a powerful antioxidant that brightens the skin and helps protect against environmental damage. And also it has glutathione, which suppresses the tyrosinase activity from the beginning of the production of the melanin. So we can address many pathways by using tranexamic acid. And with the sustained release system, it will work better for sure. And also the pain of the injection is tolerable. I'm just sharing my personal experience with the product, that it's even easy as like skin boosters to be injected, and it's really tolerable. So I talked about this, which is, but let me discuss it a little bit more. So hyaluronic acid possesses hydrophilic properties, allowing it to trap other active ingredients and slowly release them within the tissue. So the water-soluble hydrogel remains in the tissue for an extended period, reducing the diffusion rate and enhancing durability. The combination of high and low molecular weight of hyaluronic acid ensures a comprehensive approach to skin hydration and therapeutic effect durability. High molecular weight hyaluronic acid forms a protective barrier for ingredients, inhibiting them from immediate elimination within the tissue. Meanwhile, low molecular weight hyaluronic acid penetrates deeper into the skin, delivering long-lasting hydration and promoting collagen synthesis also. So the indication for using Tranex Plus is the senile spots, is the melasma, PIH, UV damaged skin tone, and dark and dull skin. We can treat the face, neck, and body, any area, even intimate area and sensitive areas are treatable with the Tranex. It's safe to do it. We need 4 to 6 sessions and 2 weeks interval for the treatment. And also, you know that we need like aftercare, and if you don't stop the treatment, it will come back. So by now, is there any question about the thing? Any problem, anything that you want to mention before I continue with the other products? Or shall I continue?
I have a question.
Yeah.
Hello. So I have a
Yes,
question.
yes, yes.
So if you have like post-inflammatory pigmentation, okay, I know we can do a couple of treatments, mesotherapy, and the problem
Yes.
would be solved. But what if we have it due to the like hormonal imbalance? So how many treatments because that is an ongoing situation. So how
Yes.
long the treatment should go, and how much can be reduced if not eliminated totally, and
So
how many sessions?
I couldn't hear, I think, the entire question, but as far as I can hear, I will respond to it. So yes, if it's hormonal, of course, it needs like constant treatment. Of course, you should, it's better to like finish the first 4 to 6 sessions. You will see the result. And with the melasma, mainly we are talking about melasma in this case, yes?
Yeah.
Yeah, with the
Yes. Yes.
melasma, when it start to showing again, we can start with the treatment. So this is like my approach and my strategy to treating the pigmentation. Even with other treatments like peeling is like that. I do, for example, if I'm gonna do peeling for the patient, I finish the sessions of the treatment, I will give the good result to the patient. Whenever she's satisfied with the result, whenever the patient is satisfied with the result and said, okay, it's perfect, 90%, 100%, 80, depends on the patient. You have the satisfaction, then whenever you can see the pigmentation is coming back, you can start. Also, with the other products, I will introduce the other products now that are like, uh, I don't know, we can use it less invasive. You can use it also like at home as a home care. With additional treatments with home care, they can reduce the rate of melanin production. So, but they needed like retreatment, like or the second course of treatment later. Yeah, thank you very much. So,
Thank you. Gracias. Thank you.
awesome. So we have the GSH, other product in the brightening and anti-pigmentation line. It has L-glutathione and vitamin C. Uh, Again, I don't want to go like thoroughly to the details because it has glutathione and vitamin C. I described it before. So it is effective with the pigmentation, yes, of course. And in my opinion, why we can use this, the GSH, other than the Tranex, because we have Tranex. It's, in my opinion, it's amazing. It can work really good. So why we need another product? So GSH is the powder form. So it's the best solution to mix it with PRP. So you can use the GSH in combination with PRP to maintain the result. Also, it has the like general brightening effect. So with the Tranex, you cannot cover the full face of the patients for sure, but with GSH in combination of the PRP with usage of Dermapan, stamp, or roller, even at home with stamp or roller, you can maintain the result. So we can make them stay longer. The only contraindication, it should be avoided during the pregnancy, and it's a very good combination for the PRP. And if we want to reconstitute it, we can use sterile, injectable, normal saline, 5 ml for the reconstitution. And because the pigmentation is in the epidermis layer, my application for using products as mesotherapy is with the Dermapan for sure, and with a depth of less than 1 millimeter. Also, we have next product, Dermaqual, which has lower dosage of glutathione. Also, it has extra vitamin B9, folic acid, which regulates the melanin synthesis. Also, Halidris silicosa extract that can reduce the tyrosinase activity and melanin synthesis. And superoxidase dismutase, potent antioxidant, and reduce the UV damage. Indication is for the intimate areas, armpits, elbows, and knees. It's like the other choice. If we don't want to use the Tranex, we finish the treatment. We want to maintain the result, so we can choose Dermaqual for the intimate area, like armpit, bikini area, knees, and elbows. The application also can be superficial nappage, very superficial nappage, or still my preference is using the microneedling with the depth of less than 1 millimeter. But if the patient choose not to have Dermapan on the and like those areas, still we can use the superficial nappage technique. And also we have the ascorbix, which is vitamin C, as it's said here, it has 225 milligrams per ml. is a really high concentration of the vitamin C for mesotherapy, and it's a lightening agent and also gentle exfoliant. Also, it can produce collagen, and it's a potent antioxidant. So we can use it for the PIH also. We can use it for collagen synthesis, for rejuvenation, and brightening. So it decreases the melanin formation, and also it can reduce the acne, but it's a little bit controversial because we cannot use Dermapen when we have active acne, and the injection can be a little bit painful. Yes?
My question is that if I am injecting Dermacal in a patient in her armpit, and after 2 sessions, still she has not shown any result, am I supposed to add something else in it, or just patient has to wait for another 2-3 injections?
You can, this is my personal opinion. You can start with the Tranex and then continue with the Dermacal. But if you want to continue with Dermacal, you need for sure multiple sessions. Except tranexamic acid, I haven't seen any products that can like show the result in one session. Like 2 sessions of mesotherapy for the armpit and like not having a significant result, I think it's totally normal because it's like a constant production of the melanin. It will take a long time to have result with the mesotherapy for sure, other than a tranexamic acid that you can see the result from the first session.
Okay, so it means that not only this Dermaclat, I have to add some tranexamic acid on the as a mesotherapy, or in a drip form or something like that.
As a mesotherapy.
Okay. At
As
the
a
same
mesotherapy, no. You can not necessarily in the same time. You can do 1 or 2 sessions of Tranex Plus, and then you can continue with Dermacal.
Okay.
Yes.
So my treatment duration will increase from 5 sessions to another 5 sessions. You mean in 10 sessions I'll commit?
You can start, for example, 2-3 sessions of the Tranex. You will have good result that for sure your patient will be satisfied with the result, and then continue like 3 to 4 sessions. You shouldn't extend the sessions for the patient for sure from the first course of treatment. But of course you have to inform your patient the pigmentation will come back. If you do intensive peeling, also the pigmentation will come back. This is something that all of us saw before and have seen before. I think this is just my opinion. Of course, if you have another opinion, we are open to hear it from you.
Okay, thank you.
Most welcome.
My question is, so when it comes to the efficacy, and if there is a very deep pigmentation, would you grade all of your brightening ampule? Which one we should start first, and then what would be for the maintenance? So which of the ampule we start with the active treatment, and with what would we end or we do the maintenance?
So my choice is, if you don't have any contraindication, of course, there is not that much contraindication for the Tranex Plus. You can start with the Tranex Plus because it's better to do it with injection. It's better to do it with injection, and of course, it's like superficial and nappage, but you will go to the dermis layer. So if you mean the melasma, which is deeper, we don't have pigmentation in deep layer of the dermis. We have maximum in the junction of the dermoepidermis, which is melasma. So if you want to treat that, we go intradermal, still try to stay superficial, and for sure we will cover the deepest pigmentation into the skin. I think we can start with Tranex plus and then maintain. Depends on the area. We can maintain with the GSH for like face or body. We can maintain with Dermaqual for the like armpits, arms, knees, and like genital area.
Thank you so much. Thank you.
Most welcome. Okay, so I think it's finished. The brightening part is finished. So again, if there is any question, then we have only one product in rejuvenation line, which is Exocell, and it will be brief.
Hello, sir. I have a question, please.
Yes, please.
Sir, which one is most effective? Like if we inject with meso syringe or if we inject with Dermapen
For which product?
for pigmentation for PIH?
No, I mean which
The
product?
transdermic
I mean
one, the transdermic
mainly
one, the new one
Transdermic. I think with the injection.
with the injection.
Yes, better
As
than
you
the
said, that it's
Dermapen.
very
This is
much painful
my
and
personal, not that
okay.
much with the hyaluronic acid.
Yes, yes, yes.
Yeah.
As you mentioned it, it's very much irritable and it's very much painful. So if we inject with the Dermapen or microneedling derma roller, so it will also reach to the desired area. So it's less painful.
Of course, of course.
Uh,
But
then why don't we prefer? Yeah.
The thing is like previous products with which contains tranexamic acid
Yeah.
was like too much painful. But this
Yeah.
one, because of the mixing with hyaluronic acid, it's very
Yeah.
tolerable. I tried; it's very tolerable. Like injecting other mesogels, like injecting
Okay.
I don't know if I can name or not, but like other mesogels which doesn't have lidocaine.
Yes.
It's a little bit burning, but it's tolerable. It's tolerable, but if the patient cannot tolerate, of course, with Dermapen also it can be absorbed and can be injected.
So I mean to say that if we can inject on both ways, then I think both should be having same results.
With I cannot say that, but it is my just personal experience with the Napage, because you depot the product and it has the sustained release formation. It will have better effect.
Yeah.
It will have better
Okay.
effect,
Thank
and
you so
you
much.
will
Thank
see.
you, sir.
You will see with the first session.
Yeah.
You will see even with the melasma. You will see with the first session the difference.
Yeah. Yeah. Thank you so much,
Yes,
sir.
most welcome.
So, excuse me, can you hear me?
Yes, 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 please.
My question is that the new one product, Tranex Plus,
Yeah.
we used 1 week before. What is the actual mixing method? You know, it's in a gel form. So
Yeah.
when I inject it on patient skin, it feel very pain and very discomfort. So sodium chloride or with the help of lidocaine, which will be more effective?
I think it's better not to mix it because, of course, it will.
But as you know, it's in a gel form. It's very thick
Yes.
and very concentrated.
So, which needle you used for
I always
injection?
use 26 or 30 kg.
30?
Yes.
With 30, I did it with even 32. I know it's hard, and
But,
I know
but
it's
after
a little bit painful. It's painful, I know, but it's tolerable. Even other mesogels, when you inject, it's painful. If you want to stick to the dermis layer, if you want to go like to subcutaneous tissue and inject the mesogel in the subcutaneous tissue into the fat, of course, it's not painful. But if you inject the
So we
mesogel,
don't need to dilute it.
it's better not to dilute it. It's better not to dilute it because it
But
will change the composition of the product. But in case you don't have any option for that, you can mix with a little bit lidocaine. But still, I think the second choice, if you cannot inject it, is using the Dermapen or roller.
all right. But the
Yeah.
direct inject method is much safer than the
Mm.
infusion. But I sent an email on Dermaqual, but they told me the
Yeah.
protocol that they should have to use 1% of lidocaine in 4 ml.
Okay. I will check them. I will check with them for sure with the respond. Okay. To see, but it's possible to mix it. Yes, it's possible, but it will change the composition a little bit for sure. But it's possible to mix
Okay,
it.
and my second question is that uh,
Yes, please.
can we use DQ hair, which is hair booster, compared to exocells, which are the like main, which one is more potent?
I think I will tell you this also, okay, because I haven't started the Exocell, but you can also mix it. You can mix the DQ hair with the Exocell. It will make it more comfortable because like
We
DQ
can mix
hair
it together.
is, I think, but still
DQ
I will check
hair
with.
is also very painful meso, very painful meso.
Yes, that is why it's just
I'm
little
using
concentration,
it's
little amount.
DQ
If
hair.
you mix DQ hair, personally, I will use it with Dermapen and roll, or I will mix it with a little bit with PRP.
No, but in your Dermaqual Mexico Academy, that is
Yeah,
on Facebook, YouTube page, they told the
yeah,
matter that you should have to direct inject this DQ hair into the scalp.
yeah. But of course,
So
it's your
whenever I
like,
added lidocaine, it's still painful,
yeah, yeah, true.
and the
Yeah,
pain was beyond
but
imagination and expectations.
that is why personally I don't use it alone. I mix it with PRP. I will mix it with HA35 and also with Exos.
Okay,
And it's not painful
HA30,
anymore with that.
HA30, okay,
Yes,
HA35.
yes, yes, yes.
Compared to exocells on hair fall, so when we use exocell further, so what are the clinical trials that we get so good results like other exosomes, like Resiles, Exovex in hair growth?
I'm not aware about that. I'm not aware about that, but if you can send email, of course they will be in touch with you. They will respond because I don't have any idea about that, so I cannot say anything. Sorry.
Yes, thank you.
Hello, Assalamu alaikum. There's a
Hello.
question. Can you hear
Yes.
me? Okay.
Yes, please.
So there's a question. Can we mix this Transex plus into PRP and inject?
I don't think I'm not a fan of mixing the Tranex actually
Okay.
because
No.
it's a sustained release. I don't recommend any mixture with the Tranex. Purely, it's amazing. You will have a really good result.
Okay. Thank you.
And no, yeah, no problem. So, shall I continue to the Exocell short, and then again, if there is any question, I will answer for sure. Okay, so and let me just check the
Assalamu alaikum.
chat box here
I have a
also.
question.
Yes, please.
Uh, how much Tranex X should be used in single session for sun tanning?
For sun tanning,
Yes.
for
Can't we use it
tanning,
for sun tanning?
I'm like for tanning. which surface, which area you want to treat?
She means
Paint.
photoaging.
Sorry.
She means photoaging.
Photo aging. Just it depends. It depends on the area that you want to treat. Sometimes I use like for a face, I use sometimes totally 1 ml. Depends on the. You can cover the area of the pigmentation. I will share some videos for sure afterwards. I will share some videos of the application. For example, just now I'm imagine if you have like a circle with like 2 centimeter diameter, maybe 0.34 ml, 0.34 ml is enough for like a circle of 2 centimeter diameter.
Sometimes patients come for, like, if they are back from any picnic or somewhere, they want their pigmentation to get back to normal. So in that condition,
Mhm.
can we use tranexamic
Eh,
acid, Tranex plus?
Yes, but you cannot cover the full face with that one. It's not tolerable. Like literally, if I come to you, so I have sunburn. I went to, I don't know, beach. I have tan. I want to make my face whiter. In this case, I prefer to use GSH with Dermapen. You can cover full area of the face. You can
You can
cover
use it
even
with
body.
microneedling, right?
Yes, with microneedling with GSH mainly, but also you can use Tranex. But like injection, you cannot inject a full face. Nobody can do this. You cannot cover all the area. Tranex, in my opinion, you have to target the pigmentation. If you have even a single spot, like with 1 millimeter of diameter, you can go directly inject it. And what I do very superficial nappage, and I go a little bit deeper, and I will a deeper underneath and intradermal. So as I do it, I will see the pigments like inflated, and then it means that you cover all the area of the pigmentation, and you can uh, see you covered it, and for sure you will have a very good result.
Okay, thank you. Go to Exocell.
So yeah, just let me finish it soon because I think yes, we exceeded the time. So what is exocell? Exocell contains a substance secreted from cells, isolated and purified from extracellular medium and known as Zika exosome, which is the extracellular vesicles. And they're sized between 30 to 150 nanometers in diameter. And the exosome are the smallest types of extracellular vesicles, offering excellent absorption and enveloped by a lipid bilayer. So they can be absorbed and there is no alive particles inside that. The Zika exosome can do cell regeneration that promotes the repair and tight packing of the damaged skin. Also, it has anti-inflammatory properties, which provides relief and rejuvenation to inflamed skin. And it can also help with wrinkle improvement with increasing the elasticity of the skin. The science behind Zika exosome. I don't want to enter all of this. That's just the name of some genes, but it can help with collagen synthesis, elastase inhibitions, and It can also regulate the melanin biosynthesis and inflammation, and also it can enhance the skin barrier. In the exocell, other than the exosomes, we have PDRN. It's a very good and well-known ingredient for repair and stimulate the tissue regeneration and also anti-inflammatory properties. It has the hyaluronic acid, panthenol, and RNA and DNA complex. Pale rose extract can make hydration and protection of the skin. And plant callus stem cells that has the anti-wrinkle and anti-aging properties. Also, vitamin C as antioxidant. How we can use the exosome? We can use it for anti-aging as like kind of skin booster, which can hydrate, which can improve the texture, which can even reduce the wrinkles and promotes the collagen production in the skin. Also, we can use it as a regeneration agent for healing, for example, for scars, for acne scars, for even hyperpigmentation by reduction in the inflammation. We can use it as whitening. And also for the scalp treatment and hair, we can use the exosomes that can cause the hair regrowth. The protocol is 4 sessions with 2 weeks intervals, and you can repeat the whole cycle every 6 months. I don't know if there is any question about the exosome also, because I presented very briefly.
So I have a question.
Sorry,
So
I
my
can't hear you
question
well.
would be, hello, can you hear me now? Can you hear me now?
Not yet, still not
Hello.
good. Yes.
Okay.
Now
So
I
my
think
question is,
now it's okay. Yes.
mhm. So my question is, so when people are providing with the human-derived exosome, how would you think that your plant-based exosome would surpass those exosomes when it comes to the results?
Yes, even I also have same question. Because Sika
I
exosomes are
cannot
more, have
hear
more
you
good
well
properties
still, but I
than
think how we can compare the human-based exosome and plant-based
Yep.
exosome.
Yes.
How I
Yes.
can claim that this is better, I cannot claim this
Mm-hmm.
is better
Yep.
necessarily. But many patients prefer not to have human-derived products. Personally, I have patients that when you tell them you have this is stem cell from what or exosome, they ask what is
but our
exosome.
major concern
I
is
tell them
our
exosome is the
major concern is
messenger. Sorry.
okay. Our major concern is about results. So I just want to know that, as you all know, in previous history, Sika exosomes are mostly used in the only skin regenerative medicines or related to skin, like anti-aging. But I don't think so. Okay, it have more good results in hair growth, hair regrowth. So that is my
I can,
first question.
sorry. I didn't hear the end of the question, sorry.
My question is, Sika exosomes are mostly used in cosmetic grades products like anti-aging creams, like
Yeah.
wrinkle creams. But as you mentioned that your DQ exosomes are especially for hair regrowth. So how could be it will be better
No.
than
I didn't
human
say
derived
you. I
exosomes?
thought you can try it for the scalp. You can, it's not especially for scalp. No, no, no. You can try it on
So
the
we
scalp.
just only can have a trial.
No, no, I mean, it's not a trial. It's not for sure a
And
trial,
can you
but also we can use also for the other
share
exosomes.
the picture of after before of clinical trials?
No, I don't have it. No, I don't have, but we will provide for sure. Of course, we can provide you with the
Alright, alright.
before and after.
Okay. As
But
you mentioned
mainly
that
the usage is
we
for
should
the
have
face.
four
Of course,
sessions.
it's not for the scalp. But for
Yes,
the
yes,
other
I
exosomes, but the
understand.
other for the
Only
other
for face.
exosomes, also for the scalp and the face, there is no difference. Okay, but you can use it for the scalp. Yes, there is no contraindication to do that. But the for the
Hello, Dr.
effective,
Bakshali.
yes,
Hello, can you hear me?
yes, yes,
Yes,
yes,
I am Sajid from Dermalite. You can use on healthy scalp because it has anti-inflammatory properties. So
yeah,
doctors are using in inflammatory scalp. So there's no need to confusion. It's used for face and healthy scalp for healthy scalp also.
yeah.
And as
Thank you
far
very
as
much.
and as far as is the safety concerns, it has a very safety and compatibility other than the exosome because it has plant-derived exosome. Thank you.
Thank you very much. Thank you very much.
All right. Can you tell
So
us the quantity
actually,
to be used every session? The quantity of the exosomes to be used in every session, especially for the scalp.
Sorry, I think two people were talking together. I heard two voices.
I was asking that if you can brief us about the quantity to be used in each session, the
In each
amount of,
session?
yes.
Yes, yes, yes. Okay, okay. So usually, personally, I mean, and usually I use like 5 ml for the full face, and I combine it with injection and microneedling. I do 2 or 3 ml of injection plus 2 or 3 ml of microneedling. This is the amount that I use. And I use it, of course, after fractional lasers, after radio frequency microneedling, I use it without using the microneedling extra. So I use the injection plus I use it topical. Of course, it will be absorbed after doing radio frequency microneedling. So, and this is my idea about the exosome. Always combine it actually with the other treatments. It can boost the other treatments very much, other than using the exosome only. I use it always with like more than 90% with radio frequency microneedling.
And what about the
so
scalp?
first,
Same 5
If
ml
I
for the scalp also?
about this scalp, you can use 3 to 5 ml.
and what would be the preferred depth of the needle for MTS or microneedling with exosome
Sorry, I cannot hear.
for scalp? Hello?
Yes.
Sorry. So my quick question is like, how much would be the needle depth, preferred needle depth for the exosome application when it comes to the scalp?
For the scalp, you can use 2 to 3 millimeter. You can use it because the skin is thicker
I'm
and
sorry,
the follicles
could
are
you
also
repeat?
2 to 3 millimeters.
Okay, perfect. Thank you.
Yeah,
The needle depth. I'm talking about needle depth.
needle depth. Yes, yes, needle depth.
Okay. Okay. Thank you.
in how much, excuse me, I need the question. Can you hear me?
Yes.
My question is, in how much session Exocell give results on rosacea condition? Rosacea skin condition.
Okay. Okay. In how many sessions? In how many sessions? This is a tricky question for rosacea specifically. Um,
Because
how many
in
sessions?
last 2 years, I
Yeah.
okay, because in last 2 years, I get these so amazing results with the help of EGF Genesis. And now you
Yeah.
improve the formula as you add some plus PDR and in it. So I also super excited to try this new one. But as we achieve the result in minimum 6 to 8 session in rosacea condition, not in 2 to
Yeah.
4. So can we have good? Most of patients come to abroad and they don't have time for their follow-up. So can we have any 70 to 80% results in 1 or 2 session, and especially rosacea?
Rosacea needs long-term, even with IPL, needs long-term treatment. It will come back, but you will see improvement with the exosome. Uh, the thing is, you will
We
see
just only
improvement even with one session, but it will come back. So it needs the repetition of the treatment. But if regarding the the result for the patient from one session, you will see even with the first session. But if you stop
okay.
with the first session, it will come back.
All right. Thank you so much
Yeah.
for having me.
Okay. You need anything, any question about that? You can just email us or call
Thank you.
us.
Yes, yes,
Thank
is
you for your
recorded.
hearty effort.
Okay, it's recorded. Yes, for sure, we will share it. Plus, we will provide you the some videos for the treatment. Just for example, for the exocell, how we treat after radio frequency or with microneedling only.
Thank you, Dr. Bashiri. One thing I want to add, if we compare exosome, our exocell with the other exosome, it has a benefit like if the storage condition, you can
Yes.
store it in 15 to 25 degrees centigrade, unlike others who has just 2 to 8 degrees centigrade.
This is true. Yes, 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 exactly. So there is no need to keep in the
Yes.
fridge for the
Yes, thank you.
exocell. Yeah.
And due to
Thank you very
natural,
much.
yes, yes, thank you very much. Thank you.
Thank
Thank
you.
you.
Thank you, everybody. And I hope to see you soon again.
Thank you. Thank you.